We have a very short presentation about the COVID vaccine to start, which will address the questions you have. Also, there'll be opportunities after to ask questions and also during. So please feel free to send your messages on the chat box and we can answer any of the questions. And don't be shy, because remember, if you don't ask, we're not going to know. So please, it's very important that you guys interact and you ask the questions. So hopefully our panel can answer them. So I'll pass it over to Dr. Bnar to start the presentation.
Thank you, Brother Moseem. I'm going to try and share my screen if our hardworking team behind the scenes allow me to. I think you need to make me host or co-host, Imad. Got it, brilliant. So I've got a short presentation on the COVID vaccines. Just bear with me while I get it up and running. There we go. Okay, so just to begin with, a quick introduction into COVID. I think everyone here knows what COVID is by now. It's a new virus from the group of viruses called coronavirus. It causes symptoms of fever, cough, loss of smell and taste, and also diarrhea. You can catch it by droplets, which are formed when people speak, cough and sneeze. And if they have the virus and you're stood next to them or near them and you're not wearing a mask and they're not wearing a mask, you can catch the virus. And it can also survive on surfaces. And so that's why we say to wash your hands regularly. COVID kills, and sadly our communities in particular are at high risk of this. But even for those who survive, a large proportion of patients go on to develop irreversible organ damage and sometimes even disability. In fact, 1 in 8 people who actually recover from the initial illness go on to die 6 months later because of problems they've developed as a result of the virus. That's more than 10% of people who have the virus. And this is why we say it's really important to wash your hands, to wear your masks, maintain distance with people who are not in your household, and replace the air in your homes and your workplaces. So who's at risk of severe COVID? Sadly, people from ethnic minority backgrounds are at risk of severe COVID and death. We don't really understand why, but we know this is the case. People who are obese are also at risk of this, and people who have underlying health problems. By far the biggest risk group are the elderly. I say that, but we're actually seeing more and more patients who are young, so 20, 30, 40-year-olds in intensive care and dying from the disease more and more. So then what does a vaccine do? What is a vaccine? So a vaccine works by alerting our immune system, which is the part of our body that helps us to fight infections, to something that it hasn't come across before. So a vaccine takes a very small part of the virus. If we imagine a virus as a car, the vaccine takes just the badge of the car, so it can say, oh, it's a BMW or it's a Mercedes or whatever. So that badge tells our immune system, our body, what COVID is, but cannot make us ill or anything like that because it's not the whole virus. It takes that badge, it injects it into our body, and our immune system goes, okay, that's what COVID is. I'm going to start preparing my shields and my defenses. My soldiers are going to be ready so that if you come into contact with the virus, I can fight it off and I can protect you from getting ill with the virus. We vaccinate millions of people every year and have done for many decades, and vaccines have saved millions and millions of lives. So what's the difference between a medicine and a vaccine? A medicine treats you when you become ill, but sadly, we don't have any good medicines to prevent people from developing severe COVID and dying. We do have good vaccines though. Vaccines actually prevent us from getting ill with the virus. So when we talk about the effectiveness of a vaccine, that tells you who's going to get the virus, okay? So these vaccines are up to 94, 95% effective. That means so if we had a group of 100 people, 94, 95 of those won't get the virus because the vaccine will protect them. The remaining 5, 6% can still get the virus, but it will be very, very mild. So they won't end up in hospital with it, they won't be ill with it, and they might not even have any symptoms and know that they have the virus. So that's what a vaccine does. So what are the different vaccines that are available and how do they work? So the Moderna and the Pfizer vaccine are both very, very similar. They both work by taking a small part of the virus. Remember I said the badge of the car? We take the badge of the car, the bit of information that tells our immune system what COVID is. We stick it into a drop of fat, inject it into the body, into this muscle, And the immune system goes, oh, okay, there's something new here that I need to start preparing for. So it develops antibodies and T cells. And the first dose of the vaccine gives you short-term immunity, and the second dose gives you long-term immunity, so long-term protection against the virus. The Oxford vaccine works in a very, very similar way, but rather than taking this information and putting it into a drop of fat, it puts it into a different type of virus called an adenovirus. Cannot make you ill because it's inactive. It cannot make you ill or do anything to you that it shouldn't. It just carries the information to your immune system. Your body then makes it into an mRNA. So the Pfizer vaccine makes the process a little bit more efficient, but your body does the work of turning it into an mRNA. And then your immune system goes, okay, I'm going to start building my soldiers and my defenses. So the first dose gives you short-term immunity and the second dose gives you long-term immunity. When you come into contact with the virus, you can fight it off. So who developed the vaccines? The Pfizer-BioNTech scientists were actually Muslims originally from Turkey. These are the ladies that developed the Oxford AstraZeneca vaccine, and they were insistent that whoever they took the vaccine to, so AstraZeneca, cannot make any profit from it during the pandemic. So AstraZeneca cannot make any profit from the Oxford vaccine during the pandemic. This also means that poorer countries can actually access the vaccine, not just rich countries. The Moderna vaccine works very, very similarly to the Pfizer vaccine. And what you need to know about all three vaccines is you need 2 doses for all 3 of them. It doesn't really matter which one you get because that provides you short-term and long-term immunity. They're all very effective against COVID. And collectively, they've been tested on over 100,000 people to make sure they're safe. And nearly 8 million people in the UK and about 12 million people in Europe have had the vaccine so far, and we've not had any issues. So what is actually inside the vaccine? The Pfizer vaccine contains 5 ingredients. mRNA, remember the badge of the car that tells you what the virus is, can't make you ill, can't do anything to your DNA, in a drop of fat with salt, water and sugar. That's it, nothing else. Oxford AstraZeneca vaccine, remember I said has an inactive adenovirus that carries the information about COVID, tiny amount of chemical alcohol, sugar, salt, water, and preservatives. Moderna vaccine is exactly the same as a Pfizer vaccine, but it has preservatives in it, meaning you can keep it in the fridge. There are no animal products, no microchips, no fetal cells or anything else in these vaccines. What you see here is what's inside the vaccine. I'm going to ask Sheikh now if it's okay to comment on the presence of chemical alcohol and what this means for Muslims, Sheikh.
Assalamu alaikum. Can you hear me, Bnar?
I can hear you.
Okay, so this is something that pops up always. Haram ingredients, forbidden ingredients in medicine, gelatin and other stuff. I'm not going to talk about haram ingredients in medicine generally today, just the presence of alcohol. First of all, what we have to understand is that just because something is called alcohol doesn't necessarily mean that it is the same substance. Alcohol, you can get very many different types of alcohols: ethanol, butanol, propanol. Some of these, if you consume them, you'll die. Okay, they're used in industrial cleaning. So that's the first thing that I would like to mention. Just because something is called alcohol doesn't necessarily mean that is fit for consumption. Here, what we have is a chemical alcohol as opposed to naturally occurring alcohol, which in the Quran is known as khamr, the thing that inebriates people and intoxicates people. So it's a completely different substance.
Mm-hmm.
Now the ulama, they distinguish between alcohol in medicine and alcohol in other products such as food, etc. So, for example, in creams and makeup, there are denatured alcohol, which is alcohol which has been processed and is lost its complete quality, and therefore it's no longer haram. So, similarly, the ulama, they distinguish between alcohol found in medicine and alcohol. There has to be a qualitative difference between sherry found in your mince pies and alcohol found in medicine. When it comes to medicine, then the scholars are a bit more tolerant because it's for medicinal purposes. Nobody will take these, vaccines and get drunk over them. The other thing one needs to also check is whether, especially in food products, whether alcohol, even in a minute amount, it's there because of a preservative, or it's there because of flavoring. So, for example, cakes and other things, or food products, you might get a white wine in there, or red wine. That's specifically for flavoring. That's not haram. But sometimes what you have is you have alcohol which naturally occurs because of kind of fermentation processes. For example, orange juice. If you have orange juice and you leave it out for a couple of days, you will get some amount of alcohol. Bread, you will get some amount of alcohol. That is not the haram alcohol that is mentioned in the Quran and in the Sunnah. And specifically, in the case of the Hanafi school of law, the Hanafi school of law is very lenient on alcohol. In the Quran, when Allah subhanahu wa ta'ala says about khamr, إنما الخمر والميسر والأنساب خمر, which is intoxicants. Actually, the Hanafis, they interpret khamr very, very in a reductive manner, and they say that the khamr that is being mentioned in the Quran is basically only alcohol that is derived from wine, grape wine, and also from dates. Those are the only two khamr, alcohol, that is haram. Now, that doesn't mean that you can go and drink Carling Black Label, or doesn't mean that you can drink beer or lager. It's just that when non-wine and grape and non-date alcohol are being used in medicine and preservatives, then it just makes it easier to accept that. So I hope that makes things clear, Bnar. You can see that there is a qualitative difference between the alcohol which is found in medicine and alcohol which is drunk recreationally.
Thank you, Sheikh. And just to put that into context, the amount of alcohol actually present here is so tiny. You can, as Sheikh said, you can find naturally found alcohol in bread. There is more alcohol in bread and in yogurts than the amount you actually have in the vaccine, just to put that into context. So thank you very much for clarifying that. So what are the side effects of these vaccines? So all side effects are mild and temporary, and these are the side effects that you should expect to experience, but some people don't have any side effects. I didn't have any side effects when I had mine. My husband had a few of these. Just so you know, we have been vaccinating millions of people for decades, and side effects always appear within the first 3 weeks. There is no biological reason why any of these vaccines should behave any differently. Vaccines have never caused long-term side effects, and in fact, the presence of these side effects is actually proof that your immune system is kicking into gear, getting ready to protect you. So the vaccines are safe. Who will be offered the vaccine first? That's dependent on who's most vulnerable. So this is why this list has been created. So please know that you'll be contacted when it's your turn. Please don't contact your GP, because they're so busy. They have so much that they have to do at the moment with a number of cases, and also they're trying to vaccinate people. And just so you know, there are some scam emails going around asking people to give their bank details. You will never be asked for your bank details when you're invited for your vaccine. You're most likely to receive a letter. You'll never ever be asked for your bank details. So what happens after you have the vaccine? It's really important that we continue to follow the rules even after having the vaccine. This is because it takes 2 weeks after having the vaccine to start developing that protection. It takes that long for our immune system to actually do its job. But also in that time, very few of us who've had the vaccine can still have the virus, but be well with it because we've had the vaccine and it protects us from getting ill. But we can pass it on to someone else who hasn't had the vaccine, who doesn't have that protection, and they can get ill from it. And so that's why it's important to keep following the rules. We also need both doses to get the full benefits of the vaccine. And we cannot go back to normal until at least 80%, 70, 80% of the population has had both doses of the vaccine. This is why it's important to follow the rules when you've had your vaccine. Sheikh, I'd like you to just give us a bit of a summary now of vaccines in Islam, please.
So in and of itself, if we were to talk about the Pfizer and the Moderna and the AstraZeneca vaccines, then we have fatwas from all over the world which have declared. So we have fatwa from Islamic Portal, we have fatwa from the BBSI, the British Board of Scholars and Imams. We have the fatwa from AMJA, the American what is it called, the Jurists Association, and many others, also the Majlisul Al-Majlisul Islami, Al-Fiqh Al-Islami from Saudi Arabia and others. All of them have said that from an Islamic point of view, there is nothing in the vaccine which is haram. There are no haram additives. The alcohol which is in the AstraZeneca is so minute that it's as if it's not there. And certainly there are no human fetuses in the vaccines. I mean, originally there were some discussions on including in the Oxford vaccine human fetuses, but that was later discarded. So from an Islamic point of view, as far as halal and haram is concerned, then there is nothing in the vaccines which will make it forbidden from an Islamic point of view. And we can present all the references. Ulama have looked over this. The BBSI have actually developed a paper which is called 10 top questions that people ask ulama and scholars about vaccines. The BIMA, British Islamic Medical Association, have also developed that. So from an Islamic point of view, there is nothing in there which makes the vaccine haram. Now, whether somebody takes the vaccine or not, that will depend on their own personal choices, the family situation, and in consultation with their imams, their chaplains, their doctors, and other significant others. Yeah.
Thank you, Sheikh. So just to summarize, the vaccines are safe and they're effective, and they are there to protect you and others around you from COVID. Things cannot go back to normal, as I mentioned, until we vaccinate 70 to 80% of the population with both doses. When I say normal, I mean being able to go to see your GP again for your diabetes, your arthritis, having hospital operations start again, being able to see family, going to the mosque or church or any other faith gatherings, being able to travel, eat out, etc. None of this will be possible without the vaccination. Vaccines do save lives, so please look at correct information when making your decision and protect yourself and your family. Thank you very much for listening. Here is a collage of the doctors involved in this having their vaccines, myself included. Please follow us on social media. We have regular videos and really good resources for any questions you may have. Thank you very much, and I'll pass you back now to Brother Moseem.
Okay, amazing. Jazakallah khair, Bnar and Sheikh Mansur, for your presentation. So I hope that was really informative to you guys. And thank you for filling, sending your questions via the chat box. So we have got a few questions to go through. So we'll try and answer as many as we can. So give me an opportunity now to get these questions, and hopefully we'll put them to the panel. So one of the questions was asked, but the first question was the vaccine developed too quickly? So if I can pass that to Dr. Bnar, please.
Yes, thank you. So no, the vaccine was not developed too quickly. It was developed quickly because we have the resources and the funding to do that. So there are three main reasons why we managed to get a vaccine so quickly. Efficiently, I should say. The first is technology. Technology has advanced so much that actually being able to study a virus and then develop a vaccine has gone from taking years to taking much less than that. And then once you have the vaccine and you've done your experiments in the lab and you want to start a clinical trial, you then take that, you write up your research proposal and you take it to lots of research panels made of specialist scientists. Now, in normal times, in non-pandemic times, these panels meet maybe once a month, and you have to get through multiple different panels before you can even start your clinical trial. What's ended up happening with this pandemic is that no other clinical trials were happening. So the panels were brought together to meet at the same time and to go through these vaccines at the same time in parallel. So rather than wasting months here, we could do this process in a week. So we've taken years down to a week just before we've even started actually doing the clinical trial. And then the other big one is funding. So because we had the funding to be able to do clinical trials at a large scale, we had the facilities to carry out these clinical trials efficiently. We could hire the scientists, the doctors, the nurses who could take all these samples and then analyze them to see what the results showed as we were going along. So everything was happening in parallel rather than what normally happens, which is do this, wait a few months, do this, wait a few months, do this. So no, it was technology, which has come a long way. It was scientists coming together against a common enemy to find a cure and working really hard. Normally scientists don't work the hours that they've been working. We're talking 8 till 10 minimum, all day, every day, even weekends for the last 10 months to a year. And then it's the funding and the resources made available. And if you want to know if these vaccines have undergone the same testing, the answer is yes, but actually even better, because normally we test vaccines and other medications on 2,000 to 3,000 people before we say they are approved for the NHS. These were tested on 100,000 people. That's 50 times the normal number of people that are involved in clinical trials.
Okay, great. Thank you very much for that. So we have another question. Does the new COVID variants cause more deaths? Do vaccines work on all strains? And if Dr. Naseem could answer that one, please.
Yeah, thank you for the question. A very important question. I'm used to explaining things in a very simplistic way to my patient group. It's not because they don't understand the complex theory. It's because they understand the fundamentals, I think, which is important. So when let's take the virus as an invader, and let's take your body as the defense, the antibodies it produces, the cells that defend it. Every time the invader invades, it changes itself a little bit, say, so it can become more efficient. And you know, if it becomes more efficient in invading, it'll cause more morbidity or more illness in the host. So that's what happens with the variant. The variant, with the original virus, coronavirus, it wasn't that infectious. But with the variant, it's more infectious. So say you have to be in a room for, say, 5 minutes to catch it from somebody with the variant. But with the original coronavirus, maybe we had to be in contact with somebody for 15 minutes before somebody would be infected. So it's definitely more efficient in actually targeting humans and causing disease. But luckily, I think we're lucky because the viruses, the vaccines which have been developed so far, they are effective against the variant because it actually recognizes the spike protein, or part of the surface body of the coronavirus, and it can. So far, what we know is that these vaccines are also effective against the variants. But in the future, we don't know. We need more data to see if further other variants come along, and what we need to do we need to tweak these vaccines to make them more efficient?
Okay, thank you very much, Doctor. Hopefully that was useful. So another question we have. So we're hi. Thank you for your informative presentation, Dr. Bnar. So I have a question, please. Which vaccine, Pfizer or AstraZeneca, has better proven efficiency against COVID-19? So I guess they're asking which one's the better one to take. So does anyone on the panel want to volunteer for that one?
I get asked this question in my surgery all the time, and because as GPs we're immunizing patients, and Dr. Kasim would be the same. He'd be facing this question from members of the public. I think what the bottom line is, they're both good and they're both effective. But if you want to go to the nitty-gritty, to the data of it, the vaccines have measured different outcomes. So the statistics would look different to somebody who doesn't really understand statistics. Some people might say, Dr. Naseem, you're a healthcare worker, you've had the Pfizer, and that's 90% effective. But I'm Joe Public, I'm an 80-year-old person, and I'm having the AstraZeneca. And in the newspaper or in the media, it's 65 or 70% effective. Why am I having a less effective vaccine? The bottom line is, it's not less effective. They're similar. The outcomes which were measured with both vaccines and Dr. Bnar would second this, I'd say, make the data difficult to interpret for general public. Am I right?
Absolutely. And I think if the trials were conducted in exactly the same way, the efficiency would be much more similar, because they do the same thing.
So I tell my patients they're both the same.
Yeah. And I've taken whichever one was offered to me first.
Okay, great. Thank you very much. So another question I have here is it advisable to have your immune system checked before you take the vaccine? So I guess some people, I've heard some people previously who've had flu vaccines and they've had adverse reaction to that just because of their own biology, I guess. So should we pass on to Dr. Kasim?
Yeah, no, there's no need to have your immune system checked. Like I presume what the person who asked the question was, should we maybe do a blood test or something to have a look at your immune system? No, we've got some quite clear guidance of who can have the vaccine, and obviously people who are too unwell, they won't be offered the vaccine. So we've already got that kind of information there. So no, there's no need to ask for your immune system to check beforehand. Obviously, if you've had COVID, then we do ask you to wait 28 days at least before you have your vaccine. But no, there's no need to check your immune system at all.
Okay, thank you very much. Dr. Kasim, we'll stick with you again for the next question. Do the vaccines cause infertility?
Yeah, thank you. Great question. For some reason, this keeps going round through the WhatsApp channels. Not sure where this has come from. First of all, let's look at the history of vaccines that we've done for decades. We've done millions upon millions of vaccinations every year for decades, and there's never been any study to prove that it's caused infertility. Ever since the advent of vaccinations, our global population has exponentially increased. If it caused infertility, you'd expect it to decrease or plateau. So there's been no evidence of infertility at all. And furthermore, our female colleagues, doctors, nurses, healthcare professionals, all of childbearing age, they've all had their vaccines because they have none of these concerns, because there is no evidence for this ever. So no, the short answer is vaccines do not cause infertility, and we don't expect these vaccines to behave in that way, because no vaccine has ever behaved in that way. Okay,
thank you very much. I got a couple of questions. I think they're on a very similar line. So I'm going to read them all out together, and then hopefully someone from the panel can take that on board. So I've read and heard that the vaccine includes cells from an aborted fetus, and that this can alter my DNA. I've already been contacted to have the vaccine because I'm classed as extremely clinically vulnerable, but felt torn as I'm worried about long-term effects and these fetus cells. Can you explain how safe this vaccine is if you already have scarring on lungs and from pneumonia and severe allergic asthma? And then someone's adding to this question that the gov.co.uk says the vaccine contains host cell from human origin, HEK293, human embryonic kidney cell line. In addition, why does the vaccine have chimpanzee adenovirus vector? Apologies.
Brother Moseem, so can I please answer this? So
yeah, Bnar, do you want to do the first bit about the thing, and then we'll...
Yeah. Can I just finish reading, so that I guess then you got add it all in one go then. So the chimpanzee vector, which encodes the SARS-CoV-2 spike protein, and the final part is Pfizer and Bnar companies use the fetal cell line HEK293 in the confirmation phase to ensure the vaccines work.
I don't know, make up that if you want. Just tell me you want. Just aloo, naan, and fluda.
Sorry, guys. I don't know what's going on there. I'm just going to finish the final part of the question. All HEK293 cells are descended from tissues taken from 19th century elective abortion that took place in the Netherlands. So I know there's a lot there. If you want me to go back to any part of that question, please let me know. But yeah, if you guys want to answer that one, if possible.
So the question, I think that there are three main parts. There's fetal cells, there's chimpanzee virus, and then I'm clinically vulnerable. Can I have the vaccine? Okay.
Yeah.
The fetal cells, first of all, No, there are no fetal cells in the vaccine, and I can say this with confidence because we know exactly how the vaccine was developed and what's inside the vaccine when it's injected into you. That fetal cells has come from, so when you develop a vaccine, you have to do lots and lots of spot checks. You do those spot checks to make sure the vaccine is safe and to make sure it's going to work, even before you inject it into a human being. And that's what the panels, before they start a clinical trial, say is okay to do. One of those spot checks that was done for the vaccine to test a part of it used copies of cells, not the actual cells, copies of cells from an aborted fetus in 1970. I'll just repeat that again. So one of the spot checks that was done to check the vaccine's safety used copies of cells from an aborted fetus in 1970. None of that makes it into the vaccine. Okay, it's a spot check that's done for safety, and then what's actually produced in the vaccine doesn't have any of that. The ingredients that are in the vaccine are exactly what I showed you in the presentation. And you can see this in the ingredients list as well. That's the first thing. Chimpanzee virus, it's not a chimpanzee virus. It's called adenovirus, and it's used as a platform to carry the information of COVID, the badge from the car, if you remember, to tell our immune system what it is. The reason it's called the chimpanzee virus is because chimpanzees, or the ape population, us included, can have the virus, inactive virus, injected into us, and it will stay long enough for our immune system to actually read the COVID information, but not long enough to cause any problems. So it's not from chimpanzees at all. It's grown in the lab. So that's where that comes from. We don't have chimpanzee viruses in the vaccine at all. If you are clinically vulnerable, then you should take this vaccine more than I should take this vaccine, because this virus is much more dangerous to you than it is to me, even though I'm BAME, Black and ethnic minority background. The people who are dying from this virus are the clinically vulnerable, and the people that need the protection of the vaccine are the clinically vulnerable. So if I was your doctor, I would be, I know the decision is yours, but if I was your doctor, I would be advising you to take the vaccine.
Yeah, I'd just tag on to that in terms of, my patients that I'm seeing, and I'm sure what Dr. Naseem is seeing on a day-to-day basis. If you've got a lung condition that's got scarring on the lungs, and my speciality in general practice is asthma and COPD, that puts you at a high risk of, if you caught COVID, of having an adverse outcome. You're more likely to go into hospital. You're more likely to end up on a ventilator compared to me, who doesn't have any of those medical problems. It's all a relative risk, but that's why it's important for you to have the vaccine, to have those soldiers and those army and the shield, like Bnar spoke about in the presentation, so that when the virus does come into your body in the future, you're ready. You've got an immune system. You've got a defense to fight that virus. And coming to the severe allergic reaction, because yes, in the beginning they were telling people not to have it when you have an allergy, but the current guidance is very clear. If you've had any allergies, that does not mean that you cannot have the vaccine at all. It's only if you've had a severe allergic reaction to an ingredient in the vaccine that's made you go to hospital, or you needed an EpiPen. That's the only reason when allergies come into play. Having a medical allergy to medicines or having a food allergy does not mean that you cannot have the virus. If you are concerned or you are unsure, you speak to your GP, or if you're invited to the vaccination hub, there is a dedicated doctor there who goes through these questions, and any concerns they will go through and do the checklist. Also, there's a fantastic webpage called anaphylaxis.org.uk, which will answer quite a few of these common questions where people have asked them frequently. I have this kind of allergy. Am I allowed to have the COVID vaccine? But for that specific question that I believe it was a sister who asked that question, sorry if I got that wrong, that I would say that no, you do not have any contraindications to this vaccine.
Can I just make an add-on point there, Kasim?
Yep.
Just from anecdotally, what's happened in one of my clinics. A 75-year-old lady turned up in my clinic and said that she had the polio vaccination when she was a child and developed, I think, a tummy pain and a bit of a fever afterwards. And she was told she had an allergy to the polio vaccine, and so never had any vaccinations again. And she declared this to me when I was about to inject her with the COVID vaccine. So a lot of people, they get confused. What is an allergy? or what isn't an allergy? What is anaphylaxis or a serious allergic reaction and what isn't? I think the salient point and the key point you've made is severe anaphylaxis or severe allergy that's necessitated hospital admission is something we need to worry about. A stomach pain after, say, a vaccination you've had, like a flu vaccination you've had, a low-grade fever you had, is not an allergy. And that's really, really important, I think, for your public.
Thank you very much, guys. A very detailed answer there.
Sheikh wants to ask a question, wants to mention something.
Sorry?
Sheikh Mansur has his hand up.
Oh, sorry, I didn't see that. Sorry, Dr. Sheikh Mansur.
Yeah, Assalamualaikum. So I just want to add my comments on this human cell line. Where does this question comes from? So as the esteemed doctors here have mentioned, that there is no presence of human cell line in any forms or DNA in any of the vaccines, the COVID vaccines. Nevertheless, one of the reasons why this question rises in people's mind is because previously, in previous vaccines, non-COVID related vaccines such as chickenpox or shingles or rubella, human cell lines have been used, and these cell lines basically comes from cells from a woman by the name of Henrietta Lacks, who died in 1952, and also another anonymous donor of aborted fetus in 1962 in Stockholm. And these then the cell lines, W1 cell lines, were taken from the lungs of these aborted fetus, and they were then used in rubella, in chickenpox, and in shingle vaccines. Now, from a fatwa point of view, these cell lines, so it's not that they're killing babies, okay? It's not the killing babies just to take these cells. If you, for the non-medical profession, if you understand what a DNA is, what a cell is, if I was to give you an apple, okay, and I had sweaty hands, the chances are, and you were to eat that, the chances are that you will have my DNA and you will have my cells on that. So the ulama, they have mentioned, they've looked into this, specifically a mufti from Bradford, Mufti Amjad Mohammed, has actually written a paper on this. And his conclusion is that the cell lines are so diluted, you know, they're on the level of nanoparticles, that we don't even consider that. We don't agree with the idea that babies were aborted back in 1962. But since the cell lines have been made and it's so diluted that from an Islamic point of view, from a fatwa point of view, it's non-existent. So even, you know, those vaccines which have been used, cell lines have been used, such as shingles, rubella, and chickenpox, from a fatwa point of view, it is permissible. I just wanted to add that. As far as the COVID vaccines are concerned, it's zero. There's nothing in there.
Okay, Jazakallah. And that's a really important point, because obviously the webinar is also to answer, you know, if you're having Islamic concerns about the vaccine as well. So Jazakallah Sheikh for enlightening us with that. So I'll carry on with the questions now. So this is a common question which I personally heard as well. So people are very anxious and worried about the long-term or medium effects of the vaccine, because people say, you know, maybe there hasn't been enough time to kind of find out about that ongoing. So Dr. Bnar, would you be able to answer that one?
I'm sorry, I was answering questions in the chat. Could you just repeat the question for me?
Yeah, no problem, no problem. Like, you're doing a great job, really busy. So the question was, how can we be sure there are no medium or long-term side effects to the vaccine, Dr. Bnar?
Yeah, thank you. So as I said, we have been vaccinating for many decades and have vaccinated millions of people every year in those decades. And what we know about vaccines is actually, when it comes to side effects, they are the safest treatment intervention that we can offer. They're actually safer than things like paracetamol and ibuprofen, which you could buy over the counter. They have fewer side effects, and we know more about their side effects. And what we know is that 90% of side effects appear within the first few days, and they're the ones that I mentioned in that. And the other 10%, the rarer side effects, appear within 3 weeks, but they are all mild and they are all reversible. And this is not different for these vaccines, because they do the same thing. So there is no reason to be worried about long-term side effects. The thing that I want to highlight here is that having the vaccine will protect you against COVID. But if someone who's had the vaccine was going to have a heart attack and die from a heart attack, it's not going to stop that. So when we vaccinate our elderly population who have lots of other health problems and they don't get COVID, great, that's what the vaccine's supposed to do, but they keep dying of all the other things that kills old people, like their heart problems, cancers. That doesn't mean the vaccine isn't working. That just means they didn't die from COVID sooner, so the vaccine did its job. Does that make sense? So please don't be alarmed if you hear elderly person had the vaccine and then died a year or months or whatever later. We need to figure out what they died from, and I will guarantee you that it will be because of underlying health problems, but we investigate this very, very carefully before we can carry on vaccinating, okay? So just be reassured when you hear things like that, please.
Yeah, that makes a lot of sense, in the sense of like people kind of, you know, if they've had the jab and then kind of scapegoating any other ailments to the COVID. So yeah, COVID vaccine rather. Yeah, that's a very good point. And the whole purpose of the vaccine is to prevent you from getting COVID, not to make you immune to it and every other condition out there, right?
And that's one of the reasons why you have to wait a month after catching coronavirus for the vaccine, because some people can have symptoms of coronavirus and the after effects of coronavirus for up to 28 days, if not longer. So it's very easy then to have if you have the vaccine within 1 or 2 weeks, to attribute tiredness, lethargy, headache, chest pain, breathing difficulties, not being able to go back to work. This is what the kinds of patients that me and Dr. Naseem are seeing, these long COVID, wrongly to the vaccine, when actually it's still the lingering COVID and the after effects. No one talks about the long-term effects of COVID or the medium-term effects of COVID, but they all want to know the long-term effects of the vaccine. And we are seeing long COVID and how this has impacted fit and well people who are still not going back to work. I have at least 5 or 6 patients, young, fit and well, who are not able to go back to work 2 or 3 months after catching coronavirus with no underlying medical problems.
And the symptoms they present with are so varied, aren't they?
Yeah.
The other point there is that when you've had your vaccine, it takes 2 weeks for your immune system to kick into gear. So if you have your vaccine, you can still catch COVID in the 2 weeks until your immune system gives you that protection. Does not mean the vaccine is failing. That's just how long your body needs to be able to read the vaccine and say, okay, I'm going to get my soldiers ready. Okay, that's why when we get preliminary data saying, oh, this country's vaccinated X percentage, but people are still catching COVID, that's not anything to worry about. It just needs a bit more time for the population's immune system to catch up and actually get the protection of the vaccine.
Yeah, that makes sense. Okay, we'll carry on with the questions. There's quite a lot. I'm running out of time as well, so we want to make sure we get all the questions to the panel. So can pregnant and breastfeeding women have the vaccine? So that's can pregnant women and breastfeeding women have the vaccine? So I'll ask Dr. Naseem if you can answer that, please.
Yeah, common question. Unfortunately, we don't have the data yet to say that it's totally and utterly safe in pregnant women, so it's not routinely offered. But you have to remember there are the group of pregnant women who are vulnerable. So women who have got underlying health problems, maybe kidney problems, lung problems, even heart problems, who would definitely benefit from the vaccine and who should get into a discussion about having the vaccine with their GP, with their consultant, because the benefit of having the vaccine for them, both from a immunological point of view and a clinical point of view, would outweigh the risks. And there are very minute risks, I think Dr. Bnar would second that, of having the vaccine. So we need more data. The clinical trials are still ongoing. And that's a good thing, because if you look at the whole scenario now, the government's not just saying everybody can have it and everybody should have it. It's a safety approach. It's an approach based on clinical trials, based on science, and based on best practice, you know. So the data is going to come out soon. We're expecting that is going to be recommended for all pregnant women, because there's no reason from an immunological point of view that pregnant women should not be vaccinated, but we still don't have the data. And go on, Bnar.
No, I was saying, please continue. I'll just come in when you're done.
Okay, and I think with breastfeeding women, there's no problem. I think breastfeeding women should be vaccinated, and if those antibodies, soldiers and shields go through into the fetus, into the baby, into the newborn, that's a good thing. That's going to protect the newborn from having the virus, from having coronavirus, and potentially having serious disease. So vulnerable pregnant women, vaccinated, should have a discussion, and they should have a low threshold to get vaccinated, and routine vaccination for pregnant women. Watch this space.
Dr. Bnar, did you want to add to that, or?
Add that we never ever routinely give anything that's just been approved, any new medication or new vaccines to pregnant women or children. We don't do it, and so this is no different. Doesn't mean that it's not safe. It just means that every single safety protocol and normal safety procedure that we follow has also been followed in these vaccines. That's all. We are offering it to women who are at high risk of catching COVID or at high risk of getting really ill with COVID, because it's a risk-benefit ratio. We know how bad the virus can be for those women, but we don't think there will be any problems with the vaccine. So that's why that risk-benefit ratio. In fact, many pregnant women who work in the NHS have had the vaccine without any issues, and many breastfeeding women have had the vaccine without any issues. And as Dr. Naseem said, the soldiers that the immune system builds to protect us from the virus has been found in breast milk. So those babies are getting the benefit of the vaccine, the protection from the vaccine, just because their mums have had the vaccine themselves.
Okay, thank you very much for that. So someone's mentioned about some deaths in Norway. I'm not familiar with that, but hopefully the panel can answer. The question is, so that 33 elderly people who died in Norway, it was just coincidence and not vaccine related, or it has just speeded up their deaths because they were going to die anyway. So this is the person's asking, this is why people are scared. So Dr. Kasim, are you able to answer that one?
Yeah, I'll answer that one. I remember when this story was released, I was in clinic and my phone went haywire with pinged messages from all the brothers from the community, some generally concerned and some feeling vindicated that they'd proven that the vaccine was unsafe. Now, yes, these deaths occurred, these number of people died. I believe it was 23 number of people who died in care homes in Norway, right? But that group of people, over 80s in care homes, they had 20,000 of that population were vaccinated, and 23 passed away. But there's no proof that they passed away because of the vaccine. You know, it's been investigated. Yes, the headline came out. They didn't give us time to investigate. You know, the Norway's public health, whatever the agency that they went in, they investigated. These were frail, elderly patients who had other comorbidities as well. There's no proof that it was due to the vaccine. But, and if you, and how can I say that? Well, then I went and looked at the data then as well. And on a weekly basis in Norway, 400 people die a week in care homes, you know, of other conditions, heart attacks, strokes, old age, all the other comorbidities as well. So at this moment in time, I don't think you can make a link between the vaccine and these deaths, because there's not been shown on any investigation that they've done. I hope that answers the question as best I can, but that's from the data that I've looked at.
Okay, thank you very much. So this is another question we have here. It's a really good question, actually. So how long does the immunity of the vaccine last? Or do you have to take a vaccine in the next 6 months again? So, and the chat goes on to say, in relation to the above, if we need to take 2 vaccines a year, would it mean we need to take these 2 vaccines each year for the rest of our lives?
I'll take that, if that's okay. So immunity depends on 2 things. It depends on our body's immune response and how long that immune response stays. So what happens is when we have our vaccines, the people in the trial are still being followed up, and they're still having those soldiers, the T cells and the antibodies, the soldiers from the immune system, their numbers tested. And we're expecting those numbers to continue. So we're expecting that immunity to continue. As long as that immunity from the individual carries on fine, we don't need to have any more repeated doses. The 2 doses are enough. Sometimes, like in other vaccines, you need like another booster after a few years. We don't know if that's the case here, but that depends entirely on our own immune response and if our protection from the immune system carries on. The other thing that depends on is new strains. So the current strains that are out there are all covered by the vaccines. If a new strain emerges, it will also be tested to make sure the vaccine is effective. And when we talk about effective, it's not is it effective or isn't, it's how much protection, because a vaccine will always give you at least some protection against a new strain because it's from the original virus. So how much protection we get will decide whether we need to update the vaccine to make it really, to give us the best level of protection, or if the level of protection that we get is enough for any new strain, then no, we don't need to repeat any doses. So if we don't get new strains or get new strains that the current vaccines cover, and our immune systems continue to show that they are producing those soldiers, then no, we don't need to have any repeated doses after the 2 doses.
So thank you very much, Dr. Bnar. So we have I think this is more of a legal question, this one, rather than a medical question. So have drug companies been indemnified if something goes wrong? So I'll pass on to Kasim, if you can answer that one, please.
Yeah. Again, this came up in the media and it kind of blew up on WhatsApp as well. The government have taken on the indemnification because it's a new vaccine. So what that means is that if you were to get any of the side effects that have been listed, and it was found that it affected your ability to function, you could potentially sue the government. They've taken they've got the indemnity. But the myth that's been spread around is that, look, this is so unsafe, and they're protecting the drug companies, and they've taken the indemnity off them, and all. Then it just everything seems to escalate. It's important to know that if anyone has any effect to the vaccine that's not on the side effect list or known reaction, that indemnity is null and void. Because that's not what the government indemnified for. It's indemnified for what the risks that we anticipate or we know about. So actually, then the drug companies will be liable. So yeah, so it's not true, that myth.
Okay, thank you very much for that. So yeah, there's a lot more questions coming through. A lot of things to add. So guys, really thanks to our panel as well to going through all these with us. I'm just going to quickly get our next question on. Sorry, I'm a bit of issues here.
I think there was a question on there regarding if they don't have the vaccine, would they be allowed to travel abroad? Almost like a biological passport.
Yeah.
I'd take that unless someone else wants, or Dr. Naseem.
Yeah, did you want to take that one on for now? Let's sort this out.
Should I take that one?
Go on, Kasim. Yeah, do that one then.
So yeah, so from what I understand, that there's no such thing as a biological passport. So you not having this vaccine does not mean that you will not be allowed to travel, or to travel you need the vaccine. What it may mean is that you have to carry on doing what you're doing now. Testing before you go. And if you go to an area that's high risk rates of coronavirus, you may have to come back in quarantine for 14 days. So it may mean that things may not change for you, but to refuse you to go, that was clarified, and they were very clear that there'd be no biological passport there. I think there was a second part to that question, but I can't remember. So I just want to make sure I've answered the question fully. So no to the biological. Oh yeah, I think the other question was, if they had refused, could they have the vaccine again? Yes, look, we want you to make an informed choice. We don't want to force a choice on you. If you don't want to have the vaccine because you generally are fearful, fine, we're not going to force you to have this vaccine. If you change your mind, let us know. You may have to wait a bit because we are working down a list. But yeah, it's not you've got to make a yes or no, and that's if you say no, we'll never vaccinate you again. No, that's not true.
Can I just second that? I think Dr. Kasim has made a really important point for us in practice. The channels of communication are open. The doctors, the nurses, everybody's there to have that discussion with you about the benefits and the potential or small risks of the vaccine. And those doors won't be closed. And if you change your mind, you can approach us, approach the practice, approach whoever you need to get this done. So the doors will be open. And that's really important, because it is a group of people who think they only have one chance, and they have to say yes or no on the telephone or go to that appointment. No, you've got time to think. You haven't really got time to think, but you should be able to weigh up the pros and cons in your mind. I think that's really important.
I just want to add to that if I can, because yes, you have time to think, but we also have an active pandemic. So you're going to be very, very limited in what you can do, as will the rest of the population, until we have a certain percentage of the population have both vaccines. And in that time, you can catch it. And we know the virus causes death, and we know it can cause irreversible organ damage and disability. So the decision is yours in what choice you make, but you have to weigh the realities of the virus against what we know about the vaccine. And that's the choice that you have to make.
Some of the brothers and sisters are mentioning that other countries are requiring certificates of vaccination. We have no control over other countries. I can only tell you what the rules are in this country. But frankly, you know, you go to countries in Africa, you have to have a yellow fever injection before you're allowed in. So each of the countries may have their own rules. So yeah, so thank you for that point. If that is true, thank you. You know, we're more than happy to you know, not change, but you know, change what we said then. But yeah, so if that's true in Saudi Arabia, that's not something that we can do. That's their rules. That's what they've decided. We have no control over that.
Mm-hmm.
Yeah. Okay, thank you very much, guys. So another question. I've had COVID. They want to know if they still need to have the vaccine, because I'm assuming maybe they feel like that their body's already immune to it now that they've had the vaccine. So Bnar, would you like to take that one?
That's an excellent question, and it's a very common question. So the answer is yes, because we know that if you've had COVID, lots of people have been tested for their immune system to see if they've developed that protection, and some people have and some people haven't. And even the ones that have developed that protection have developed short-term immunity, short-term protection, not long-term protection. What the vaccine does is it guarantees you that short-term protection and that long-term protection during the second dose. So if you've had COVID, actually, I've had COVID and I'm having my vaccine, and that's the advice that I would give to.
Okay, thank you very much for that one. So another question. I think this one's again for you, Bnar. They're addressing you in this one. So hi, Bnar. Is there any evidence to suggest people who have received the vaccine are still able to pass the virus on to others? How important is it to continue to follow the current advice on maintaining social distance, washing hands, and wearing face masks in public after vaccination? So that's from Tom. Thank you very much.
Thank you, Tom, for that. Very, very good question again. So what we know about the vaccines is that they provide very good protection, actually better protection than most other vaccines that we routinely use. They provide about up to 94–95% protection versus the flu vaccine, which only gives you 50% protection. And even then, the flu vaccine has been shown to save many lives. So that's really good. What does that protection actually mean? It means that if you take 100 people who've had the vaccine and you expose them all to COVID, 94 or 95 won't get the virus. The 4 or 5 or 5 or 6 that do get the virus, even though they've had the vaccine, will have a very mild illness. So you've guaranteed that no one's going to end up in hospital and no one's going to die from it. But most of them won't get the virus, and the few that do still get the virus either won't know it because they don't have symptoms, or they'll have really mild symptoms. But we don't know which of those people that will be. And so that's why it's really important to keep following the guidance, because we don't know, once you've had your vaccine, you take 2 weeks to develop your immune system to give you that protection, so it can catch it before then. After the 2 weeks, you can still get it, but your risk of catching it is very, very low. And even if you have it, you might not know it, but you can pass it on. And you can pass it on to someone who hasn't had the vaccine. And that's why I keep talking about this 80% people have to have both doses to get the protection. Because what will happen is, as we're vaccinating more and more, the restrictions are going to be eased off very slowly to see what impact that has on spreading. But nothing will go back to normal until we have 80% of the population having both doses. That means the risk of spread will be so low that the vaccine will do the job of doing what it's supposed to do, which is to protect us.
Yeah, that's really important. Sorry, was anyone saying anything? So I think that might have been a thing.
I would just echo the fact that, yeah, once you've had the vaccine, to still do space replace and ventilate, you know, so make sure that you still follow full social distance guidelines, because it does take 2 weeks for it to build up a level of decent immunity, and also it could be on you, and even though you're not feeling the symptoms because the vaccine has worked and you've got an immune system, you don't want to potentially pass it on to somebody who's not had the vaccine.
Yeah, that's really, really important there as well. And just a reminder, it's important in our religion to stay our hygiene. So guys, we definitely got to keep washing our hands. Yeah. So even if you had the vaccine, keep washing your hands, keeping your distance. Because it's going to take some time. So yeah, let's not slack on this one. Yeah. So we got more questions. So I'm not sure who's going to answer this one. And maybe, Sheikh, you can do this one as well. You might have some information on this. So my worry is Bill Gates' involvement. Are we sure these billionaires are not involved? And I don't know what they mean in what capacity, but someone's asking this question about the involvement of billionaires with the vaccine or the virus. So, Sheikh, do you want to give that a go?
I don't think that's a Sheikh question. I have no idea. I have no idea. I mean, the only thing that I've seen in Netflix is that Bill Gates is doing some really good sanitation programs, but beyond that, I'm sorry, I don't know.
Yeah. Anyone else in the panel would like to take that one on board? Go on, Bnar.
No.
No. Oh, okay. Sorry.
I can do that confidently because.
Can I just make a point? Sorry, Bnar. Go on.
Of course.
No, Bnar. Ladies first.
Oh, thank you, Dr. Naseem. I can say that confidently because of the very, very strict processes that vaccines and treatments have to go through to be developed, to be tested, to then be approved. They have to be approved and given the go-ahead by multiple panels of independent scientists that have nothing to do with government, nothing to do with vaccine companies. And when the process for treatment goes from I've got an idea, let's develop a treatment, to when it's then available for the public via the NHS, that process is so strict that lots of medications fail along the way and they're never made available. The ones that are made available are the ones that are safe. No, Bill Gates has nothing to do with any of the vaccines. If he did, I wouldn't have had the vaccine, and I've happily had mine.
Okay, thank you very much. Yeah, I thought that was a bit of a difficult question because I didn't think it was quite a medical question, but that's what maybe I thought Sheikh might have had some information on that. Anyway, so keep moving on because time is going. So is there evidence for increasing the interval between two vaccine doses from 3 weeks to 12 weeks? Dr. Bnar, would you like to take that one?
Again, a very good question. So we've got 3 different types of vaccines. When Oxford AstraZeneca did their trials, they actually gave the participants vaccine from different people, were given 3 weeks all the way up to 3 months. And what they actually showed was that you get more protection if you increase the interval to 3 months, first of all. So anyone having the Oxford vaccine, the majority of people in the UK will, because that's what we've ordered the most doses of. There's plenty of evidence to support that you get very good protection even if you increase to 3 months. That's fine. The Pfizer only looked at 3 weeks, but the Pfizer is an mRNA vaccine, and the Moderna, which is also an mRNA vaccine, did look at giving the interval up to 2 months. So not quite 3 months, but 2 months. And they also showed that people who had it 3 weeks apart all the way to 2 months still had very good protection and developed a very good immune response after their second dose. So I can't tell you if Pfizer will for sure give you the same protection after 3 months, but because of what we know about vaccines and how they work, there is no reason why this shouldn't be the case with Pfizer as well. The reason the government made this decision is because we are dealing with an active pandemic and really high cases, people in hospital, people dying. Our hospitals are overwhelmed. And when you have 100 vaccines and you have to make a choice, do I give 50 people full protection or 100 people some good protection? They decided to go with 100 people some good protection. So that's why the decision was made.
Just a question on it. Is there any is it, if someone, there's 2 doses, if someone takes the first dose but they were for some reason unable to take the second within the time frame, or they weren't able to take their second at all, is there any reaction, or is there anything with that, Dr. Kasim?
Yeah, if that happens, they're to restart the schedule is my understanding. So they'd have to take another, so if they had 1 but they went past the time frame for whatever reason, they'd have to have the 2 doses at a later date. That was the last time I read the guidance. That's what they said.
And again, that's fine because we've been doing vaccines for so many decades. That happens frequently. If anyone has a child in this group, they'll know that when it's time, I've got a 3-year-old, when it's time for her vaccination, she has a flu-like symptom, I have to delay it and delay it. Because it's been done like that so many times, we know that that's okay to do.
Okay, then. Thank you. So next question, how long after having a vaccine a person can feel safe to go out with precaution? And Assalamu alaikum, how long after the second vaccine will I be able to see and hug my primary age grandchildren and know that I'm safe? That, you know, obviously, I think a lot of people are struggling with that, the social interaction aspect of it. So I think they're very eager to try and get this vaccine done so they go meet their family members and loved ones. So Dr. Naseem, would you like to take that one?
Yeah, I think after the first jab, you tend to get some protection, and after quite a lot of protection, and then after the second jab, you've got more protection. But you have to remember, you have to carry on following the government guidelines, what the government says, you know, and we have to rely on their advice. So if the advice is that you have to wear a face mask and you shouldn't be going next door to meet your mum and dad or whatever, we have to keep on following that until the guidelines come through to us. That's both a legal obligation and also a moral obligation, I think. In terms of that's my viewpoint on it. I think we should be dictated by what people in authority tell us, and take heed of that.
And the reason for that is because even though you will have had your 2 doses and the protection, there may be others you come into contact with who haven't, and they can still get COVID because you might be carrying it but not know it because you're so well because of the vaccine. They can get it from you and get very, very ill. But that risk is reduced drastically when larger and larger proportions of the population have had both their doses, which is why I keep going back to the 70–80% of the population number. That's the kind of the magic number that we think we're going to need to vaccinate to be able to just go back to normal.
This is where the concept of herd immunity comes into place, and sometimes in practice we try to explain this to patients that you know, having the vaccine is not just for them, it's for the wider public in general, so this stops being a pandemic, stops spreading the way it's spreading. That's really important.
We mustn't lose sight of the fact that, you know, in this wave we've got twice as many numbers of people in hospital beds than in the first wave, and we have more people on ventilators in this wave than we did in the first wave. And the first wave went up and down quite quickly. This has been a continuous rise, and it's a very wide and long time period. It's had a lot of strain on the NHS, and so it's not just necessarily about how many people can vaccinate as well. We have to look at the numbers and the statistics and see as the deaths are coming down and the cases are falling, and then inshallah the hope is that we can then start to open up things as per the government guidance.
Okay, thank you very much. So I've got more questions. So we've got 15 minutes left, guys. So also if patients have or are immunocompromised, you can explain that to me. I don't know what that means. Patients can still have the vaccine, but will need to be aware that the vaccine may not be as effective and will still need to continue with precautions as they normally would. Is that the question?
Well, yeah. So you know, people who have low immune systems because of they could be having cancer treatments, or they've had recent radiotherapy, or they're on medications that reduce their immune system. You know, these are precautions that we tell people when they have the flu jab or any other vaccination that they're having. You know, that the precaution, they need to take more precaution. The more at risk you are, the more precautions you need to take. Is
that what immunocompromised means then? You have more risk?
Yes, your immune system is more compromised relative to, say, myself, Bnar, yourself, Moseem, like that, and Dr.
Okay, thank you very much. So I've gone on to the next question. Many people on social media are reporting adverse side effects and neurological problems like uncaudible shaking and tongue spasms and Bell's palsy. I also have two vaccine injured children who got better when I stopped vaccinating them. I am here to get transparent truth, but the information is conflicting with the observations being reported.
I can take this if you like, brother.
Yes, go on, Bnar, please.
So the neurological side effects, I've seen these videos, and I've also discussed them with lots of doctors who are actually specialists in neurology, who deal with this sorts of problems all the time. This is called functional neurological disorder. Functional neurological disorder is actually very common, and it's been around for a long time, long before vaccines were a thing. Unfortunately, it's not an easy condition to treat because these are patients who have investigations, have every test under the sun to look at their muscles, their veins, their vessels, sorry, their nerves, their brain, their spine. Everything comes back normal. Functional neurological disorder is a psychological problem, and these patients actually respond really well to psychological therapy. These vaccines do not cause any problems to do with this controllable shaking, and I can prove that to you because if you talk to these patients, and actually on the video one of them said this, that the shaking goes when they go to sleep. It just disappears. If the shaking was completely involuntary, i.e. if there was something wrong with the nerves and the muscles and everything, it would continue in your sleep. Okay, I'm not saying they're doing it on purpose. I'm saying that psychological problems can sometimes, and they do, show themselves in physical ways, and we see this very, very commonly. So no, that's not related to the vaccine. Bell's palsy can be a very, very rare side effect of vaccines, and it always gets better, and it does respond to steroids. So Bell's palsy is different to these things. And yes, Bell's palsy can happen as a result of vaccines, but they do get better.
And Bell's palsy
and just
equally.
to clarify what that is, Bell's palsy is when one side of the face, the muscles just stop working for a little bit. The nerves that supply those muscles have a palsy, so they stop working for a little bit, but they do get better.
And Bell's palsy is very commonly seen in general practice.
Yeah, for lots of reasons, not just vaccine.
For lots of reasons.
Yeah, absolutely.
Just to say something else about this, I think if you look at a lot of psychological illness, like if you look at depression, if you look at anxiety, if you look at behavioral problems, they tend to have what we call somatic symptoms. So they tend to have physical symptoms. And we spend a lot of our time, and Dr. Kasim will say the same, chasing these symptoms. And actually what it is, it's depression, it's anxiety, it's behavioral issues. And this could be a similar type of manifestation of symptoms, I think, maybe.
Okay, thank you very much, guys. I'll carry on with the next question. Do the vaccines contain microchips? Dr. Kasim, do you want to take that one?
Can I take that one?
Yeah, well, I got no other thing to say on that.
Yeah, I'll take.
Go on, Dr. Naseem.
I think my mobile phone's got a better microchip than the vaccine. I think if somebody wanted to trace me, they'd probably trace me on my WhatsApp or trace me on my Facebook or trace me on whatever I use rather than inject me with a vaccine. So, no.
And just to make it, I'm not trying to make this like harder or anything, but you know, my wife's on Amazon and she's on my Amazon, and I'm not sure she's listening. She'll kill me if I admit this. She buys something on Amazon, and because it's my Amazon account, if I go on Facebook, I start getting adverts of what she's buying, and I know exactly what she's bought, even without looking at the email. You know, we have already have got tracks and traces already in place. You know, we do not need to be vaccinating people to track them or to trace them or to do whatever. No, there's no chip in the vaccine.
Can I just add here? I think that statistically, people are caught on camera 150 times a day. Now that people are not going out due to COVID, it's not as much, but statistically 150 times a day. So if somebody wants to really track, you know, your Amazon devices and your Alexas, I've got 4 of them in my house. If somebody wants to hack into my house and see and hear what I'm doing and saying, then they can. So we're all everywhere, we're surrounded. But I think there is a conspiracy mindset amongst the Muslim community, I have to say, where everything is first and foremost, anything from the government, straight away, people just freeze and think that the government is out there for people. I think I mean, certainly the government, there is a trust issue there, but there is also a lack of confidence as far as tawakkul is concerned, right? We live in this perpetual fear, and we generate these conspiracy theories to make us feel good. So, for example, when the COVID-19 virus, we went into lockdown, people were saying, oh, it was 5G, and it was made it's a biohazard, and it was made. And I was saying to people, okay, Let's for 1 minute accept that this is a human-made COVID vaccine. So what? It's still killing people. Does he make it better then? So my point here is, I think that we need to have a bit more taqwa, and we need to have a bit more tawakkul in Allah subhanahu wa ta'ala, because at the end of the day, if there's anyone who's all seeing, it's Allah subhanahu wa ta'ala. And we need to have the resilience. We need to build this tawakkul, that it doesn't matter what disease there is, or it doesn't matter what vaccine there is. At the end of the day, it is Allah who gives diseases, and it is Allah subhanahu wa ta'ala who takes away that disease. Without Allah's orders, nothing will happen. And I think that is the thing that we need to be conscious of. And ta'budallaha ka'annaka tarah, that you worship Allah subhanahu wa ta'ala in such a way as if you can see Allah. And if you can't see Allah, then at least know that Allah is watching you. That is the thing that we need to be worried about. As far as all of these conspiracy theories, they will make you go mad. There's a hadith in Sahih al-Bukhari where the companions asked, Ya Rasulullah, when is the day of judgment? And the Prophet ﷺ said, what have you done to prepare for the judgment? In another hadith, the Prophet ﷺ says, if the day of judgment was to come and one of you is planting a tree, let him carry on planting a tree. Meaning, you do your thing. If you're not doing anything wrong, and if you have your confidence and tawakkul in Allah subhanahu wa ta'ala, nothing can harm you. That's my 2 pence on this.
Sheikh, quickly, just for the people not familiar with the Islamic terminology, what is the meaning of taqwa and tawakkul?
Taqwa basically means being conscious of God. We have a morality where our morality basically allows us to do things and not to do things because we are in the presence and in the grace and glory of God. Tawakkul basically means to rely on God and to have the belief that everything that happens in this world happens with God's permission. Everything that doesn't happen in this world also happens because God doesn't allow it. We find a very famous hadith in Sunan Tirmizi, one of the books of prophetic tradition, where the Prophet says to his younger nephew, وَعْلَمْ لَوْ أَنَّ النَّاسَ اسْتَمَعُوا عَلَىٰ أَن يَنْفَعُوكَ بِشَيْءٍ لَن يَنْفَعُوكَ إِلَّا مَا كَتَبَ اللَّهُ لَكَ. That, fear Allah and be conscious of God, because know that if the entire humanity were to gather to harm you in some way, they won't be able to harm you other than if Allah allows it. And if the entire humanity was to gather to benefit you in one way, then they won't be able to benefit you other than what God has willed for you. So we have this higher level of medicine, and all of these things are good. These are only causes and effects, but at the end of the day, as Muslims, we also rely in God. And those are the kind of things that we need to rely on, rather than trying to pacify ourselves through conspiracy theories.
Okay, Jazakallah khair. We're going to move on swiftly because we're running out of time as well, and we've got a few more minutes. Will children be given the vaccine is another question. So Dr. Kasim, do you want to take that one?
At this moment in time, children are not part of the vaccination schedule, and that's because, as Bnar mentioned earlier, it's not something we do with new immunizations or vaccines. But my understanding is that they are, Bnar knows about this, but they are going to be, aren't they, Bnar?
They are starting trials, yeah. And I think they either have started or they will be starting trials soon. And I wouldn't be surprised if, in a year's time, we're just vaccinating children for this routinely. But no, you're right. The reason we haven't is nothing to do with, it's not about worry about there being unsafe. It's just what we routinely do for new treatments and medications. But we are starting trials in children.
I just want to say, I know people say that children are not do not necessarily get that unwell. I've had one of the youngest babies to have caught COVID and have Kawasaki. Go and read up about Kawasaki. People have no issues with reading about all these conspiracy theories. Read about Kawasaki disease, okay? Youngest baby, the types of medication that poor baby is on. Mashallah, the baby has survived. Mashallah, the baby is thriving. The medication that child has to take on. I've also had a child that was in ITU. The father rang us and thanked us for saving a child's life. They became seriously unwell. So, there are children out there who have serious illnesses who are at risk of having nasty effects to COVID. So yes, the reason for the trials are because we need to protect those children as well. So, just want to make that clear.
Yeah, because if there was no benefit to these children having the vaccine, we wouldn't be testing to see if they needed to have it. And there will be some children who are vulnerable because of other illnesses. They may have transplants or other illnesses, and those children will be contacted by their specialists, and those discussions will happen with their parents about whether the vaccine is safe for them now or not. So it's not a blanket no, just like anything. but it will be, if you are contacted about your child who's vulnerable for whatever reason, please go and speak to your doctor. They will take the time to explain everything to you. The decision is ultimately down to you as a parent, and that will not change.
Okay, thank you very much. So we're definitely running out of time shortly. I'm going to give one more question. I found this question a bit personal, actually, for you doctors. They're asking, the question is, how much are you doctors making from giving the vaccine? I don't know if you want to disclose that.
Can I take that one?
Go ahead, Dr. Naseem.
So in a nutshell, we're not making money from this, especially when GPs give the vaccination. And in my practice, I've taken the task of making sure that both the nurse gives the vaccine and also the GPs give the vaccine. Number one, because we're building on those relationships we had with the patients who we haven't seen for 2 years or a year and a half. And so we're able to see them, we're able to touch base with them, and we're able to give them the vaccine and explain to them so they can explain all the information around it, all the queries they might have around it, and disseminate that into their communities. Because usually the people we're vaccinating are the above 80s and the 75 to 80s. That's the cohort that we've got in practice to vaccinate at the moment. And these are really important people because they go out and they spread the message in the community, and that's really important. So we're using this this opportunity, in my practice at least, to disseminate this information and to make sure it's carried to all members of the community. Well, we're making a loss in my practice by doing this for the GPs who are involved in doing this, because we pay a GP more for the session than we gain, more for their work than we gain from doing the vaccination. So that's how I would invest into the practice.
Yeah, so for most it's going to be cost neutral. Some may make a small amount of money. Most are going to lose out on money. For example, we were told that if you need to vaccinate X amount of people, as a GP surgery, I may have to hire a hall out and pay for that hall if I can't do it safely. That's what they were telling us with the flu jab, but also with the COVID vaccination as well. We have to pay for our nurses, our admin, receptionists. If we open up weekend clinics, we have to pay them time and a half. That all comes from the money that we get for the vaccine. And also with all that, we've got to carry on doing our normal routine Monday to Friday morning, afternoon clinics. And so if I have to then go and do the vaccination, I have to go and get a locum who has to come and cover me, because I can't just be going off and vaccinating for 6 weeks, and I have to pay that locum. So, it's not a simple case of all that money is coming into our pocket. And when you start calculating how many vaccines you're going to give and how much you're going to get per vaccine, you're going to think, our bank balance is going to skyrocket. That's not the truth at all.
There's easier ways to make money in medical practice than give the COVID vaccination. Yeah. It's a team effort in practice, and it's a huge suck on our resources, and they're limited, aren't they, at the moment?
Yeah.
And can I just say, I'm not a GP, but I know lots of GPs who have trained as vaccinators and are giving up their free time when they're not being paid for the work at all to just go and vaccinate, because they think because they know it's the right thing to do. They want to help out the workforce who's trying to get us out of this pandemic. So lots of people, nurses, GPs, doctors, are donating their time, and I will be training as a vaccinator as well to do the same, inshallah. So there's no financial incentive for us to vaccinate people other than we want to get out of this pandemic, for people can be healthy, we can get back to normal. That's it.
Okay, Jazakallah khair everyone for your questions. Unfortunately, we've come to the end of the webinar. If you want to continue answering questions, please go onto the Twitter at muslim.qamri, and you can fire off your questions to the doctors there. I'm just to pass it on to the Dr. Sheikh Mansur to give concluding remarks, and then I'll wrap up at the end. So, Sheikh, would you like to take over?
Jazakumullah khair. Yeah, there was a question that was specifically addressed to me. What's my opinion on the vaccine, and do I advise people to take it? Well, Sheikh, what's your thought of the vaccine, and from Islamic perspective, should we have it? So, as I've mentioned, from a fatwa point of view, from an Islamic perspective point of view, there is nothing in the ingredients of the vaccine which makes it haram. So, from an Islamic point of view, you are allowed to take that vaccine 100%. 100% there is nothing wrong. Should you take it, then I can't give you medical advice. You need to go and discuss with your doctors, your chaplains, you know, your GPs, others. What's my own practice? I have, well, I kind of made my parents give the vaccines. My parents are elderly, over 80 years old. They had a bit of side effect. They were poorly for 2-3 days. They're fine now. When it comes to my turn of giving the vaccine, then I will definitely take the vaccine myself. That's all I can say. And the other thing is that I am, I feel for doctors who are in frontline. I feel for nurses who are in frontline, and I think people, you should stop reading conspiracy theories, right? Rather than reading conspiracy theories, read the Quran. That is better for your spiritual health, because conspiracy theories just put your mind in filth. Okay, have some tawakkul in Allah subhanahu wa ta'ala, and inshallah everything will be fine.
Okay, Jazakallah khair. We're really running out of time now. We have gone slightly over, but Jazakallah khair to the Sheikh. And thank you to the panel for taking the time today to answer everyone's questions. And I'll just note, we didn't pay any of the doctors to come here today. They've come voluntary and of their own accord. So really, really appreciate that. Many of them have families.
Also the Sheikh hasn't been paid.
Yeah, the Sheikh
Yeah, that's very true. Very true. The Sheikh hasn't been paid. Yeah, thank you. They have families as well and other commitments. So, you know, to take out the Saturday evening to come and, you know, give us some advice and talk to us and answer our questions and concerns is really, really appreciated. Thank you to Muslim Council of Wales and all the other organisations, the Doctors Cymru Association, who've been supporting and made this happen. We'll be releasing a video of the webinar and clips as well as for anyone who has missed it. From the Welsh COVID information, please follow muslim.cymru on Facebook, Twitter, and Instagram. And guys, yeah, please, we only had limited time, so we can't answer any more questions. But if you do have any concerns, if you do any anxieties, please visit your local health practitioner. When you go to the vaccine centre, we already mentioned there's a dedicated doctor there to answer questions and, and make you feel comfortable and safe. And at the end of the day, the whole purpose was this, to give you the information, the correct information, that you can make the right choice for yourself. But at the end of the day, you have to make sure that you are safe, your families are safe, and our community is safe. And as Muslims as well, it's our responsibility to look after our communities as well as our families. So I'd please, wish you to all take that in mind. So I'm not going to take any more of your time. So I've been Moseem Suleman. Jazakallah khair for everyone. Good evening and good night. Assalamu alaikum wa rahmatullahi wa barakatuh. Khuda hafiz, everyone.
Thank you for joining, everybody.
Thank you. And as Moseem said, Muslim Council of Wales, BMA, MDC, Muslim Dr. Cymru, we're all doing it voluntarily in our spare time because we do care about our communities and we've seen the effect that this has had on our communities. Honestly, we're not asking for a penny. This is all done in our spare time. We've got a really good team around us, BMA, MDC, MCW, and we are doing it just for our community.
We do believe you. Thank you very much.
Anybody in Grange Town or Butte Town who's got any queries about the vaccination, please pick up a phone and ask to speak to their GP. Really important.
Okay.
Thank you.
Bye, everyone.